Well, hi everyone. My name is Dr. Jeff Schroder, and I welcome you to NU619 Principles of Patient and Staff Education. Each week I'll be posting one of these weekly videos. I've been doing this for the last couple years. I find that the weekly videos help to make class a little bit more real. I do record these in real time, so I record them um, throughout the class. They're not pre-canned and something that I use from cohort to cohort. So the discussion that I have here will be specific to this cohort and to the discussion points that are brought up in this specific class. And in week one, well, first a little bit of a brief overview of the class. This course in many ways builds on some of the concepts that were discussed in your NU588 course. In that course you talked more about the theoretical underpinnings and a little bit about the different frameworks that we use in education. And we'll be reviewing quite a bit of information from that class in this class as well, because really the same theoretical principles that apply to nursing education apply, or education anywhere for that matter, apply to patient and staff education as well. So although there's not a lot of redundancy here, and there's not necessarily a lot that you really need to go back and review from this course. This is kind of a progression from that particular material. And we're going to be talking about the role of the educator specific to patient and staff education. And that brings us to week number one. In week number one, we'll be discussing the role. What is the role of the nurse educator in, I guess I would say, non-educational settings? Nurse educators work all throughout the healthcare spectrum. Usually when we think of nurse educators, we think of nurses that teach either at the clinical bedside or teach in the classroom in nursing programs, but that's actually a pretty limited view. In reality, nursing educators work in every area of healthcare, in inpatient and outpatient settings. They work in community settings and in hospitals, pretty much anywhere where you find patients and healthcare being delivered. Nursing educators interface there. But the role is a little bit different, and that's what we're going to be talking about this week. And the discussion this week will focus on how those roles are different and how particularly the leadership role is very important when we're talking about patient and staff education. Just a few guidelines or a few things that I would point out. First of all, for several of you, I see that I have some familiar names in class, and so some of you I've been with before. It's good to be with you again. As far as grading goes, I follow the rubrics pretty closely, so I'll be reviewing each of the written assignments that we have throughout the class in the week prior to them actually being due. But with the discussion grading, I follow the rubrics pretty closely here as well. So please note that APA and grammar are important, so you do need to make sure that when you write, that you write in complete sentences, and that you write in a scholarly, objective writing style, and that you cite when appropriate, and that your citing should be consistent with APA. You're going to be completing your capstone courses soon, and so these writing skills are really important. So if you don't feel good about your writing, if writing is still something that you still struggle with a little bit, this is a good class to really work on that, because you're going to be doing a fair amount of writing. And so working on those writing skills is a really good focus for this class. Also, participation, the minimum expectations for participation are that you post your initial response to the discussion question by Wednesday night, and then 2 follow-up responses to peers posted throughout the week. In other words, you shouldn't just be posting or attending class on 2 days each week. Really, for full participation, ongoing participation is expected. Minimum of 2 posts to peers, substantive post to peers in the discussion questions, and posts that exceed expectations are required for full credit. So the participation isn't just a gimme here. Participation is something that is threaded through it as an integral part of the class, an integral part of the learning process as well. And of course, I'll be giving feedback this week, and in every week. So you'll be getting my feedback in class, and I'll be posting some new questions and helping to facilitate and guide the discussion. That's really my role here is to facilitate the learning and facilitate the concepts in class. Each week I'll be posting a video wrap up and introducing to the following week. So these videos will be something that you'll be seeing in pretty much every week. If for some reason I can't post a video, which occasionally happens because if I'm somewhere without bandwidth, where if you've ever worked with YouTube, if you have a slow connection, it can be painfully slow and impossible sometimes to upload a video. That's usually not the case. If it is, we'll be giving a written introduction instead, and in lieu of a video. So I think that's it. I think that that's pretty much what we need to get going. I look forward to participating in class with you. I look forward to helping to answer any questions that you have and to help you to fulfill your career and educational goals. So have a great week. Oh, and by the way, it is winter time, and it's having a lot of you are having a really rough winter out there. If you're having any issues, especially weather-related issues or any issues really, let me know. I will work with you on that. I know the Connecticut campus has been closed periodically through the storms that we're having right now. So if any of you are having any issues as far as with your internet or any of those things, let me know and I will go ahead and work with you on that. It's always best to go ahead and always communicate with your instructor and let them know any challenges that you're having. And of course, any questions that you have, please feel free to answer them. I will try to get them answered in a relatively short period of time, always within 48 hours. Usually within 12 to 24 hours. I am on the West Coast. I'm essentially down here in Southern California. I won't even mention what the weather is outside right now. It's rather, I'm sure it would feel balmy compared to where most of you are located. But I am in Southern California, so there is a time difference, so be aware of that. I spend much of my week down in Rosarito Beach, Mexico, which is another story. I'll be covering that as we go along, no doubt as well. So I look forward to participating in class with you. Everybody be safe. Everybody have a great time in class, and we'll see you in the discussion forums.